high blood pressure or hypertension is common. In this video, we're going to learn about some of the most common misunderstandings about hypertension. Around 45% of adults have hypertension. Because there may be no associated symptoms, many people do not know that they have high blood pressure. The World Health Organization reports that an estimated 113 crores people have high blood pressure worldwide. Despite hypertension's increasing prevalence, it is still widely misunderstood. First, it is worth outlining what blood pressure is. Blood pressure is the pressure of blood pushing against the walls of the arteries. Blood pressure naturally rises and falls. For instance, it tends to rise during exercise and fall during prolonged rest. However, if blood pressure is elevated for longer periods of time, it increases the risk of various health conditions. This video will tackle 8 persistent myths associated with hypertension. The first myth is blood pressure is not serious. Hypertension certainly can be serious. Without treatment, high blood pressure can increase the risk of range of health issues including heart attack, stroke, kidney disease, heart failure, angina, vision loss, and peripheral artery disease. Hypertension causes damage in a number of ways. For example, over time, increased arterial pressure can cause the vessels to become less elastic. In turn, this reduces the amount of blood and oxygen that reach the heart, thereby damaging the organ. High blood pressure can also damage the delicate blood vessels of the brain, which increases the risk that they will block or burst. The second myth is hypertension runs in my family, so there is nothing I can do. According to research, hypertension does have a genetic component. However, hypertension is not inevitable even for those who may be genetically susceptible to it. Often, the condition develops due to lifestyle factors such as diet, which genes do not influence. Adherence to healthy lifestyle is associated with lower blood pressure, regardless of the underlying blood pressure genetic risk. The third myth is high blood pressure is inevitable with age. Hypertension is not inevitable and it is not a normal part of aging. Although hypertension is more common among older adults, high blood pressure occurs in middle-aged and young adults too. Hypertension affects around 7.5% of people aged 18 to 39 years and 33.2% of people aged between 40 and 59 years and 63.1% of individuals over the age of 60 years. Despite this increasing prevalence with age, certain lifestyle interventions can significantly reduce the risk of developing high blood pressure. These include reducing salt intake, exercising regularly, stopping smoking, and eating a healthful diet. The fourth myth about hypertension is I would notice some symptoms if I had hypertension. But the only way to detect hypertension is to measure blood pressure. There are usually no signs or symptoms to indicate that someone has hypertension. This is why some experts refer to hypertension as the silent killer.
The fifth myth is
I do not use table salt, so I do not need to worry about sodium intake. The WHO recommends consuming under 5 grams of salt each day to help maintain a healthy blood pressure. They explain that an estimated 25 lakhs deaths could be prevented each year if global salt consumption were reduced to the recommended level. However, only avoiding table salt is not sufficient when limiting overall salt intake. It is important to read food labels. Salt appears in a wide range of foods, sometimes in very high quantities. Ultra-processed foods are particularly high in salt. The consumption of these foods, which include soft drinks, chocolates, chips, candy, sweetened breakfast cereals, and packaged soups may also play a role in the development of other conditions. It is also worth noting that both kosher and sea salt are chemically the same as table salt and therefore no less harmful to health. The sixth myth about hypertension is when my blood pressure responds to medication, I can stop taking it. People who take medication to treat hypertension may find that their blood pressure returns to normal. However, for many people, hypertension is a lifelong condition. It is important to follow the doctor's recommendations and only reduce or stop taking the medication when they have confirmed that this is the best course of action. The seventh myth is hypertension is curable. There is currently no cure for hypertension. However, there are ways to manage the condition and reduce its impact on health. For instance, making the following changes may help: reducing alcohol intake, eating a healthful diet, exercising regularly, managing stress, and quitting smoking, maintaining a moderate weight, and taking medication. The last myth about hypertension in today's video is only men develop high blood pressure. Although anyone can develop hypertension, men have a higher risk of doing so until the age of 45 years. From 45 to 65 years, everyone has similar risk of developing high blood pressure. After the age of 65 years, however, women seem to have higher risk of developing hypertension than men. Hypertension is both serious and common. Although it can be a lifelong condition, there are many ways to manage it and to reduce the health risks associated with it. By tackling hypertension-related myths, we can help reduce its impact on society by facing the risk factors head-on and work against them. Thank you so much for watching. Please like and share this video. For more interesting videos, subscribe to my channel. Thank you.